Good morning, everyone. Firstly, it's a real pleasure for me to be back at the World CSR Congress. I was looking at the website of the World CSR Congress, and it reminded me that last time I was here was in 2015 as a speaker. And it's good to see the legacy that this award, this event has gone through all these years in terms of promoting corporate social responsibility and corporate sustainability. So coming back to today's session, so it's the first panel of today, and it's indeed on a very pertinent theme entitled Planning and Implementing of CSR for Sustainable Future. When we talk about CSR today, it's clear that the conversation has evolved significantly. For many years, CSR was largely about goodwill and philanthropy. Today, it's about intentional planning, disciplined implementation, and long-term impact. And that shift is happening across sectors and geographies. In markets like India and across the global south, CSR has also moved beyond compliance. There is a growing expectation that corporate resources, expertise, and partnerships can contribute meaningfully to systemic changes, whether that's access to healthcare, education, livelihoods, or environmental sustainability. From my own experience, because I come from Mauritius, I'm working for Omnicane, a diversified agro-industrial group, we've learned that CSR works best when it is not treated as a standalone activity, but as an integral part of a broader sustainability journey. In agricultural activities and the rural context, which is where we are based, social, environmental, and economic outcomes are deeply linked. We cannot address community development without thinking about climate resilience, education, health, and long-term livelihoods. One of the key lessons for us has been the importance of moving from individual projects to more of an ecosystem-based approach, and from short-term outputs to measurable outcomes over time. That requires strong partnerships, patience, and a willingness to learn and adapt. And I must admit, that hasn't always been easy, and it's not going to be easy in the future as well. That's why I'm really looking forward to today's discussion. We have an excellent panel lined up with our panelists representing healthcare, pharmaceuticals, technology, telecom, and manufacturing sectors, where CSR can genuinely shape futures at scale. Over the next 35 minutes, I'm told, I'll be inviting our panelists to share not just what they do, but also how they plan CSR, how they implement it on the ground, and how they ensure it remains relevant and future-ready. And I'd encourage them to share lessons learned all the way, including what hasn't worked as well. So with that, let me start by introducing our panelists. So we have Sanjay Singh. So Sanjay is the highly respected leader in sustainability and ESG with over 24 years of experience in the cement and infrastructure sectors. He currently serves as Chief Sustainability Officer and Corporate Head for Environment and Sustainability at My Home Industries Mahacement in Hyderabad, a joint venture with CRH Europe. Mr. Singh is widely recognized for his expertise in decarbonization, ESG governance, and environmental compliance. He has led enterprise-wide initiatives spanning net zero strategy, alternative fuels, energy efficiency, circular economy, water stewardship, and biodiversity, while aligning sustainability with core business strategy and global frameworks. We're delighted to have Sanjay with us today. Then we have Deepinder Kumar. He is the Vice President, CSR and Sustainability at Vodafone Idea Limited and Head of Vodafone Idea Foundation. Mr. Kumar is an accomplished social development professional with over 20 years of experience across corporate social responsibility, sustainability programs, and monitoring and evaluation and grant management. He brings rich cross-sectoral experience, having worked closely with corporates, governments, international agencies such as UNDP and GIZ, NGOs, and academic institutions. He is widely recognized as a strategic leader with strong expertise in designing and implementing large-scale technology-enabled development programs. Over the years, he has successfully led impactful CSR initiatives across education, health, skill development, and livelihood, women empowerment, and agriculture. He is known as a strong team leader and has proven track record in end-to-end project delivery while consistently driving efficiency, productivity, and impact. Dipender, we are very honored to have you on the panel today. Then we have Shwetanjali. Shwetanjali is a passionate CSR and development sector professional with close to 18 years of experience. She brings deep social sector expertise, visionary thinking, and a strong commitment to excellence, creativity, and innovation. Over the years, she has been associated with and has led a wide range of innovative social initiatives in collaboration with governments, non-profit organizations, as well as research institutions and corporates. Shwetanjali currently serves as head of CSR for Siemens Healthineers India, where she leads impactful programs at the intersection of healthcare, community development, and sustainability. Welcome to the panel, Shwetanjali. We have also Ankit. So Ankit is the head of corporate social responsibility at Narayana Health, with over 15 years of experience in the healthcare sector and in the discipline of CSR fundraising and social impact development. Ankit Shrimali leads strategic initiatives focused on creating sustainable change through healthcare-driven community development. With a strong commitment to inclusive growth and patient-centric outreach, Ankit spearheads programs that enhance access to quality healthcare for underserved and vulnerable populations. His portfolio includes the design and implementation of high-impact CSR interventions across preventive healthcare, education, and community development. He actively drives initiatives such as health awareness programs, support for vulnerable patients, and also education assistance projects that create long-term transformation. Through his leadership, Narayana Health continues to strengthen its mission of delivering affordable and accessible healthcare while contributing meaningfully to society. Ankit brings valuable insights on integrating corporate social responsibility with public health education, grassroots development outcomes, making him a distinguished voice in the CSR and social impact space. Ankit, we look forward to hear from you, from your experience. Then we have Tushara Shankar. He has a master's degree in social work from the Tata Institute of Social Science, Mumbai, with specialization in urban and rural community development. She has more than 2 decades of diverse experience with corporate entities, international non-profit and consulting organizations on CSR and development programs across domains of health, women empowerment, water conservation, education, and agricultural-based livelihoods. She has been a resource person from the Child in Need Institute, 6-month program on NGO management and reproductive health, and a faculty member of the Indira Gandhi National Open University Rural Development Graduate Program. She has been associated with many bilateral, multilateral UN and government programs in monitoring and evaluation role. At Lupin, she heads CSR initiatives and leads the foundation of the company that works for livelihood and healthcare domains across 8 states in India. Tushara, we look really forward to hear from you on today's theme. So now, after this round of introduction about our very distinguished panelists, I'll now go to the first round of questions for them. So starting with, maybe I'll start with having Ankit next to me, so start with Ankit. So Ankit, tell me, Narayana Health is known for cost-efficient healthcare models. How does that philosophy translate into CSR planning and implementation?
Thank you, Rajiv. Good morning, everyone. I welcome the Gen Z population. I can see a lot of Gen Zs are sitting here. And it's a proud moment for you to address you all. So, Rajiv, coming to your question. See, Narayana works on a very economies of scale model. We are there in 19 locations in India. And the healthcare group caters to a lot of underprivileged patients, along with the patients who can pay. But one of our CSR programs, which I would like to talk here is, in India, I'll give you an example. In India, there are close to 434 government medical colleges. In these 434 government medical colleges, there are 22 lakh candidates who appear every year for an exam called NEET, NEET is the exam to qualify to get a seat into a government medical college or into a private medical college. So that's the entrance for getting into MBBS, pharmacy, medical, or let's say BHMS or other paramedical courses. We feel, Narayana, that in India, the doctor to population ratio is very low. The doctor to population ratio is 1 is to 2,700. One doctor is to 2,700 people. Whereas the WHO says the population ratio should be 1 is to 800. So what we do, we run a program called UDAN. UDAN is a program where we support the underprivileged kids, where we support the kids from far-flung areas, let's say from Cherrapunji, from Ladakh, from interiors of Gadchiroli in Maharashtra, from Kerala. And the goal is that they should study 1 year with our support, with our CSR support. And this CSR support is coming because of the model which we are working. So we put money on these kids so that they should study 1 year for a NEET coaching program and they should get into a government medical college. I'll give you an example. Last year we supported close to 500 kids. 500 kids means same Gen Z population between 19 to 21 years of age who were appearing for the NEET exam. They studied 1 year. Out of 500, 200 made into a government medical college. And 36 joined AIIMS, All India Institute of Medical Sciences. Now, that's a success. And these 500 kids, parents or fathers were, somebody's father was an auto rickshaw driver, somebody's father was a vada pav seller, somebody's father was a office boy. They didn't have money, but they have one thing in their mind, which was fire in the belly. One thing in the mind, I want to become doctor. And the purpose of supporting these students from UDAN program is, once they join a government medical college, they will go back to the same territory from which they are coming. So that means we are solving the problem of India, which we feel that the doctor population ratio should go down. It should be equivalent to the WHO guidelines. Also, these kids who have the potential, they need 1 year. And that 1 year cost of teaching them, we are giving from our CSR funds. So that is the low cost model by which we are giving our money for these programs to cater to those 434 government medical colleges, to cater for 55,000 government medical college seats are there in India. And once they join it, 5 years of MBBS, and they will be helping the healthcare system. So the aim is by 2047, we should be 100 years of independence, we should be in that level that we should have the equivalent number of doctors. So that's the way NH is looking to support the Gen Z population in converting more number of doctors by our CSR programs and also to other areas.
Great, Ankit. I think you've addressed a challenge and you're using it to open up opportunities for rural areas, for those who don't have access to this kind of education, at the same time solving the issue of having sufficient people in the medical profession for the future. Thank you. So now coming up to Shwetanjali. So technology has huge potential in healthcare, CSR, but also risk of excluding the most vulnerable. How do you plan inclusive, scalable CSR interventions using technology in your field?
Thank you, Rajiv. I think when we talk about CSR, this is the most pertinent questions which comes to our mind when we talk about vulnerable communities or those communities who have poor access to healthcare. So as a company, the purpose of our organization itself is to pioneer breakthroughs in healthcare for everyone, everywhere, sustainably. And our CSR interventions are totally, or I would say strategically aligned to the purpose statement. And working with the underprivileged communities is our heart and soul of CSR. That's how we have reached more than 850,000 beneficiaries in just last 4 years by working with these rural and tribal communities which are actually left out. Having said that, inclusive and sustainable CSR interventions can definitely have positive health impact. How we work by having I would say 5 key principles to CSR, starting with we have a very community-centered design approach. So we try to understand who are the underserved or unreached communities. What are the barriers they have in reaching or having access to healthcare? And third is, what is the health-seeking behavior of such communities? And accordingly, we design interventions. The second approach is that we have very strong government systems partnership, because if you see, any NGO or corporate cannot reach the last mile. but health system has the potential to reaching the last mile. So how we can leverage our resources along with government partnerships and NGO partnerships to reach last mile, that is our second approach to work. The third approach I would say is that when we talk about technology, it's not about always, high-end technology, but it needs to be facilitated with human touch, I would say. So high tech plus human touch is what we believe in, because when we talk about CSR, you have to bring empathy, you have to bring human touch. That's how we design our projects. And the fourth last one, I would say that when we talk about technology, it's not about just deploying a solution or a product, but it's more about how sustainable it can be for longer time, be it through health system approach or be it through partnering with research or academic institutions. I will give few examples to enable access to primary eye care services. We have set up 10 vision centers which has tele-ophthalmology solutions in extremely rural and tribal areas in 4 states of India. The second intervention I would like to talk about research collaboration. We have partnered with Indian Institute of Science to develop digital public good, wherein solutions, AI-based solutions are developed, and it will be open source for early detection of neurodegenerative diseases. So there are a couple of more technology-related examples. So that's how we work when we talk about inclusion and sustainable solutions under CSR.
Very interesting, Shwetanjali. In fact, very appreciated the way you talked about the multi-pronged approach. Firstly is to customize the projects to the needs of your stakeholder. You can't have a one-size-fits-all. Secondly, it's about partnership, where you need partnership so that you can access to these people. And thirdly is about the human touch, which is very important, not just technology, but also using the human touch to implement your programs. Thanks for this great insights. So now turning to Tushara. Tushara, you, from a pharmaceutical company's perspective, how do you plan CSR programs so that they strengthen public health systems rather than operate in parallel with them?
Thank you, Rajiv, and thank you to the organizers for inviting me here. Lupin, yes, it is a pharmaceutical company, and we identify ourselves as a healthcare company rather because we have services beyond just medicines. And but despite being a pharmaceutical company, the foundation has been present since 1988. So the CSR bill has nothing to do with the foundation. And we have been working on agriculture-based livelihoods for that long. We are, of course, working on healthcare as well, but the idea of the founder was to be able to give back to the society in a manner that people should not need to migrate from their locations. And what would be most sensible in a context even today, a lot of people are, more than 47% people are dependent on agriculture, but in the 80s, the numbers were close to 70%, and that is where it could have a very large impact. So we continue to work on the livelihood space also. But in healthcare specifically, which we started about 4 years back, we work very closely with the government system, like Shwetanjali mentioned. I completely align with that we, in order to make a sustainable change, we need to work alongside the government, and we did partnerships with both the state government of Maharashtra and Rajasthan to work on non-communicable diseases. And how we arrived on working on the specific non-communicable diseases was based on 3 things. One was the national priorities, of course. We all know NCDs are rising across the world, and also in India, this one of the leading causes of death. So that was one piece. The other was Lupin's therapeutic expertise. Lupin is known for its expertise in respiratory medicine, in cardiovascular diseases, diabetes, asthma, hypertension. So those were the areas that we picked. And then like I said, the foundation has been present since the 1980s. And non-profits, presence is extremely important because you have to build those relationships. For people, like she said, health-seeking behavior, all of that is not very easy to crack. So you need to have the trust from the organization. So we decided on working in the states of Rajasthan and Maharashtra based on these three priorities. And how we work in this model is that we work with the government healthcare systems. There are our mobile medical vans which are equipped with all kinds of facilities, from all the lab tests to X-ray and spirometry, all the related, all the tests that you could think of with respect to, except for things like maybe 2D echo, which are a little advanced, because for that you need a PNDT registration, and for that we have a referral system with the local hospitals. But for all other purposes, we are reaching right to the communities, to the healthcare centers. Like there are some 36 healthcare centers that we are directly reaching to in Rajasthan, and again 27 in the Palghar district where we work in Maharashtra. And the van visits every twice a month. So every 15 days, because treatment adherence is very important in NCDs. And people typically, even urban communities, have some sort of a resistance to consuming medicines, because they think my blood pressure's come down, now I can decide to not consume any medicine. So there's a lot of follow-up that is required, and for that purpose we have planned it likewise. We are working right from the healthcare system, right from the A&M level, the nurse midwife who's based at the ground level, at the health sub-center level, right to the health directorate. We are working with every step of the government institution, and we have been also working on building capacities. We have cardiologists and pulmonologists on board who are providing capacity building services to these people. Besides that, we have a very strong social behavior change communication intervention in our program, because like I said, it's very, very difficult to bring the people to access this healthcare. We are reaching out to the households to identify each one. We have community mobilizers who work with a form, fill up to identify high-risk people, further diagnosed by the nurse at the ground level, and then brought to the camp. Our goal is to not let anyone over the years, over 30 years of age, miss out, get missed out, even if he or she has a slight possibility of having an NCD. So that's the approach that we are working in. As of now, working in two districts, and we have worked for the last 4 years now. We intend to continue working until we completely, reach out to every individual in these locations, and then move to maybe the nearby district or whichever other district we identify based on the 3 parameters that I shared. So that's more like what our healthcare approach is. Thank you.
Great, Tushar. I think you also stress on the importance of partnership. And when you talk about the SDGs, one of the main pillars of SDGs is about partnership. And that's again the key to whatever success you've achieved in your initiatives. Now, turning to Dipender. So Dipender, telecommunication and information technology are at the heart of digital inclusion. How do you use technology in planning CSR initiatives that move communities from mere connectivity to capability and opportunity?
Thank you, Rajiv. And quite an interesting question, I can say, because it encompasses the 3 main pillars, we can say, that building the capability of the communities, and that too leveraging that technology. So just to explain means how we work, means that the one of the component which is integral to our, that means that for all the project activity, that is how we can leverage the use of technology for the social goods. And whether it is a field of agriculture, education, livelihood, or the women empowerment. So means it is an integral part of all our activities, project activities, and we try to leverage the technology for the optimization of the resources and to scaling up our initiative. And this has been shown the result also during the last 10 to 15 years. And that to coming on to the specific project which has been shown a kind of quite a means that means a high impact at the ground level. It is the agriculture one and the education one. I will just try to explain how That means how we are leveraging the technology in the agriculture domain. So during 2020, means we designed a project which is a smart agri, and where that means we deployed a IoT solution in the farm field. And these IoT solutions, and it is an equipment which are based on the IoT solution, and these are that are automatic weather station, then again the soil monitoring sensor, then the remote camera. And these equipment capture the real-time information of that particular locality. So means whether it is related with the rainfall, soil moisture, or the infestation of the insects. And these details we get on the dashboard, which is a centralized dashboard, and basis of the data that we get from the farm field, means we curate a farm advisory, and we send it and disseminate among our project beneficiary. And this project is across 12 states, something around 9 lakh farmers are getting benefit. And it is not only limited to dissemination of the advisory, but means also to build the capacity of the farmer, how to use it. So means we have a ground level project team also who goes in the field, that means educate the farmer that this advisory means what, and what all good agriculture practices they have to follow. So means on the basis of that, we have been able to reduce that means input cost on the agriculture by 27 to 30% of the farmers. And then side by side, we have been able to increase the yield of that particular land by something around 20 to 25%. So that's how we are using the technology, and then building on the capability of the farmer, because it is not only one way. So means what we try to do is that we try to build the capacity of the farmers also, or that means all the stakeholders also, how to adopt or how to bring in the practices which we are delivering to them under our project. So we give them a training on the good agriculture practices and how to use the digital tools. So that kind of training and the education has helped the building in the capacity of the farmers. And this will be a kind of a long process, and that our next step is like, and that making them accountable and then inculcating the sense of ownership among them, so that they will become the leader of the project and they can take it forward once we exit from that particular area. So that's how we design the project. It is a kind of end-to-end, that means leveraging the technology, building the capacity, that too with the frame of mind that means what will be our exit policy. So that kind of thing we do. Similarly, under our education portfolio, means we work from the primary education till the technical college students. Something around 50,000 to 60,000 schools we are supporting through our project, Gurusala it is. And it is a virtual project driven by a platform, gurusala.co. And through this project, we give a training on the adoption of digital literacy in the classroom, how the teacher's capacity can be built on the use of the digital technology in the teaching, and then how they can build their own capacity also. And somewhere we also do the physical training on this. And this was the project which has helped a lot during the COVID period. And COVID I consider as a blessing in disguise for our project, because that gave us opportunity to expand and upscale and then adopt the things which we were trying to bring under this project activities. So something around 50,000 to 60,000 schools are getting benefit, and these are the schools which are government and government-aided schools. Similarly, on the technical side, means we support the university, technical university, mainly the tier 2 and tier 3 tech colleges, and where we give them a kind of a training, and then we bring in the corporate leaders who means interact with the student, give them the first-hand information, first-hand knowledge, means what is the requirement when they are pass out from the college, and the kind of a skill set which are required in the landscape when they go out from the colleges. So mean apart from this, means we also have a courses and modules on the emerging technology. That has helped a lot in the technical student and the college student and the farmer. So these are some of the things which we are doing by leveraging the technology and by building the capacity of our beneficiary.
Okay.
Thank you.
Thank you, Dipender. Good to see that how you are identifying the challenges that farmers are facing and how you are bringing technology to them so that they can meet also not only the requirements, but when you look at the climate change, how it's impacting their operations and how you can bring technology to address these issues. Great. Sanjay, you are from the manufacturing sector, from the cement industry. CSR often intersects with the environment and the communities. How do you integrate CSR planning with core sustainability and environmental strategies?
Thank you, Rajiv, and very good morning to all of you. I'm from cement manufacturing sector. I'm from my home group, which we are into media. We own TV9 group. We are also into green power. We are also into cement. Cement vertical is in joint venture with CRH Europe. So, what Rajiv said, how we integrate our CSR strategy so that it is, having a smooth license to operate. Because, cement and steel and power, we are, three core sectors of the growth momentum of the country. And we are also, the largest employment generator for the country. At the same time, as far as the CSR is concerned, the integration of CSR is concerned, because steel, cement and power, we have huge operations. For cement, whenever we acquire the land, our integration starts from that stage. My CSR team, it goes to the community. We try to, build the understanding with the community that what their needs are. That's the basic, step one for the integration. From there on, we scientifically have go for the materiality assessment so that we can more scientifically can filter out what their basic needs are and what are the points which we can touch upon. Based on that, we draft our CSR strategy, because we strongly believe that CSR is not only the mandate wherein we need to, spend the amount. We have to have an approach which is more strategic in sense. Cement is very resource intensive industry. We have our own mines, we have huge operations. So integration has to be at the deepest level. So after materiality, after developing the CSR strategy, we have a proper stakeholder, platform, we call it. We have a stakeholder consultation group, which have the representations from the local village panchayats, local communities, our plant operations, and local officials. We have structured meetings. Within our operations, we have monthly meetings, wherein whatever we have decided in the CSR strategies, those points are measured, monitored appropriately, and respective officials, normally the ADC or the CDO, Chief Development Officers, or the pollution, regional officers of pollution, they are the part of our community advisory panels. Their inputs are also taken care of, and they are also the part of that entire monitoring group. Then the next integration, in cement, steel and power, we have our own dedicated CSR arm. I worked with Ambuja Cement for 2 decades. So we had Ambuja Cement Foundation. On the similar lines, we have the My Home Foundation here, wherein, it's a structural integration, wherein CSR is addressed structurally. And if we go at, one step higher, then this integration further goes with or integration of those, I mean, CSR metrics, it goes into our ESG roadmaps. Because you know, Ambuja, sorry, this cement and steel, we are also the highest CO2 generator. So government has had their own net zero. Government has commitment for the net zero by 2070. So all these heavy sectors has to be the net zero. So there is next integration wherein our CSR and environmental KPIs, they are integrated with our ESG roadmaps. And one more, I mean, further level of integration, you could say, we have dedicated, I mean, cement manufacturing associations, which is representing the cement sector at Niti Aayog level, Ministry of Environmental level. So I mean, it's an integration from the root level to the planning and strategic level at the top.
Yeah.
So it's a, I mean, complete integration wherein we try to build a symphony just like we have seen in Vande Mataram. So our team builds a symphony so that this CSR basically doesn't remains, I mean, our community doesn't remains only the beneficiary, they becomes our active partners into our outcomes. So that symphony is very important, which we are trying to build.
Great, Sanjay. Good to see that your 360-degree approach, where you're not only identifying your stakeholders, but you're also engaging with them to understand their needs and how it matches with your own priorities. Very good to see that. Mindful of time, I'll just have a second round of questions, but I'll ask you to just reply in 1 minute to each of it. So anchoring with Sanjay, since you already had the mic. So today we hear a lot about partnership. What makes a partnership truly strategic and effective in CSR? I think it links up with what you just explained, please.
Yeah, partnerships are very important, and partnerships has to be strategic actually. Because as I said that cement is a sector which is resource intensive, and we also generate huge amount of, I mean, environmental aspects and impacts.
Yeah.
So to mitigate them, we have to have a strong partnership. And again, the partnership starts, I mean, at various levels. I mean, for example, whatever we identify with the needs, suppose it has, I mean, most of our operations are in water scarce area. So we have to comprehensively work on water positivity by involving our community and our plant operation team, our corporate team in a strategic way. So that's one partnership.
Okay.
And apart from that, I mean, I would like to cite a live example actually. In my home
Briefly,
group, we have an operation in Suryapet district in Telangana, wherein there is a, I mean, invasive species which is called prosopis, which is invasive, which grows very fast. So we thought that I mean, as I told that we are mandated to replace our fossil fuel with green fuel for that net zero. So we have to have the biomass which need to be fed into our cement kilns. Okay. So we developed a partnership with the local farmers wherein they are growing this prosopis, and we trained them, we empowered them to have their own small biokilns. In the biokilns, they are converting this prosopis, which is an invasive species, into the biochar and biocoal.
Okay.
And we are the standalone buyer. We are buying, so it is generating a revenue stream for the farmers.
Right.
It is giving me an impact into my decarbonization efforts and replacing my, I mean, fossil fuel.
Yeah, sure.
So these kind of partnerships are really required, which has to be strategic, which has to be impact based.
Thanks. Thanks, Sanjay. Dipender, in your deployment of ICT tools and connectivity, how do you measure real social outcomes rather than just the reach of the technology? In 1 minute, please. Because
Sure.
Alok is looking
Sure,
at us.
So means I will just continue what I said earlier, and means we have leveraged the technology to monitor the project also, because most of our project, if you see the design of it, are based on the platform. We have a very solid website and portal for means all of our project. So means by by the means the using technology, we are able to monitor how many people are accessing our things, and what is the impact of the things which we have been able to deliver at the field level. Suppose, for example, like the courses and modules we have put for the school teachers, means but that at the back end we are able to monitor how many teachers to whom we have delivered the training are using our courses or have completed the courses which we have delivered to them during the training. So that kind of thing, it is a kind of a tool which we have used in the impact monitoring also. And then apart from that means using this tool, that means also engage the third party to monitor our outcome of the project. And that is the beauty of the role of the technology. And that has helped us in upscaling our project. And that in a year we are able to, outreach or benefit something around 22 lakh people. And till now we have been able to reach out to 2.6 crore people across India. So that is the thing.
Okay.
Thank you, Raj.
Thank you. Alok, mindful of time, can we go complete the second round of questions, or you want me to open up to the audience? Okay, great. So, thanks. So, Tushar, where do you see the biggest risk of CSR becoming ineffective to the point of becoming irrelevant if we do not adapt?
Yeah, so this is my favorite question. Thank you for asking me. Because I think, corporates or anyone, non-profits who are implementing development projects need to get to a business-like approach now. That's the time. Gone are the days when philanthropy, social good, that is what it was called, right? Whatever you do for the society is good. No, it's no longer, that's no longer the kind of discussions that we are having, and that's great because we are all talking about impacts and outcomes, and everybody is constantly looking at, our boards, the CSR committees, the decision makers are constantly looking at what value is it bringing to the communities, and at the same time also to the business. I mean, even if it's not very direct. So the ESG, the integrated reports, all are going to make, it's no longer going to be a choice. So if we do not adapt, it's going to just not work at all. Thank you.
Great. Thanks, Tushar, for this very short but very impactful reply. Shwetanjali, one particularity of technological evolution is rapid obsolescence. So how do you future-proof CSR against rapid technological obsolescence?
Very briefly, Rajiv, I would like to say that invest in a problem, not the product. Leverage open source tools and technology, and don't just create digital waste. Third, I would like to say that only device-driven CSR initiatives is really vulnerable, so don't opt for that unless you have a very concrete exit plan. Fourth is partnerships is the key. Again, I would say, for example, we are working with one of the state governments where we are trying to deploy a technology for diabetic peripheral neuropathy screening. That does not exist in healthcare delivery system. So we are trying to see that whether it can become part of the policy for further scale up. Okay. And the last, I would say, just don't focus on hardwares. Focus on having a very concrete capacity building plan. Who is going to use that? At last, I would like to conclude by saying that if we try to build flexibility in the governance, funding, as well as capacity building processes, CSR initiatives can become resilient, needless of technology being the way technology is being evolving. Okay. Thank you.
So true, Shwetanjali. Ankit, last but not least, operational excellence is known to be a key to the success of any business strategy. What role does operational excellence play in CSR success?
Thank you, Rajiv. So operational excellence, what exactly is operational excellence for the Gen Z population? It is the process which a company puts in to benefit the customers, to increase the value of the company, or to change the efficiency to a higher level. When we look at operational excellence to a CSR success, consider it like an equilateral triangle. Keep operational success in the center, and in the three vertices of the triangle, put people, planet, and profits. which is the triple bottom line in CSR we say. So when operational success will happen, or you are involving the steps of Lean Six Sigma, Kaizen technologies, waste management, carbon reduction footprints, automatically you will help the planet, you will help the people, you will do the profits. So it's an equilateral triangle for people, planet, and profit. And it plays a very important role. To give an example, just a short example, in our hospital in Bombay, we have a children's hospital. We have a lot of waste management. We have a lot of food which is get wasted every day. People are not eating, or there is a waste which comes out. What we do, we have a plant where we convert this food into a manure. We give a manure which can be used in putting in the plants. Whenever a patient gets discharged from the hospital, we give this manure to a patient, and we give a pot to him that you put this manure which have been converted by the waste management into that plant, grow this plant. There is a scan code which is again an AI technology which is linked. This QR code you send to us, and we will create that you are also helping the environment. My message to the Gen Z population, India is the 4th largest economy right now. We need to make it to a first US, China, Germany, and India. And you guys have the baton in your hand to take it further. Thank you, Rajiv.
Great, Ankit, great. So thanks to our panelists for sharing their valuable insights on today's topic. I think it's now time to hear from our audience who are here. So if you have any question, I would ask you to please raise your hand, and with the microphone, I think is going to be brought to you. And to facilitate the interaction, if you can just mention your name and the organization from which you are, and if you have any specific panelists to whom you want to address your question. So please, I think you have a first question.
Good morning. Firstly, thanks a lot for this forum, Dr. Bhatia, and a wonderful video to start the day with. I have a question from the panel, which has given a wonderful start to the whole proceedings. And this question is to Shwetanjali per se. In the technology field, data centers are being seen as the inevitable, the pivots for the future. However, they are also kind of devils when it comes to sustainability, because water and energy consumption. So how do we see it happening in the future? Are there any leaps and bounds programs to curtail this kind of a threat perception? Because I read Elon Musk is planning all his data centers in space in the future.
That is a very pertinent question when we talk about data centers. With the data privacy law in place now, it talks about data minimization, how minimal data we should collect from intervention, whatever we do. So I will limit my response to CSR. Another angle to look at it is that how long we restore data with us. If the project is over and we have defined the duration, we are going to store the data for this time. After that, the data should be deleted. So these are few things which we can do to minimize data wherever we are storing with regards to the space and cloud. Beyond CSR, I think this is not the forum to discuss because there are a lot of data.
No, sorry, Shwetanjali. Yeah. My question was pertaining to the energy consumption and the water consumption. If there's any other panelist who can answer this, I'll be.
So my response was with regards to healthcare CSR data, what we are referring to. Anybody
Anyone
would
else
like
wants to jump in? Yeah, Sanjay, quickly.
Yeah, I can address your energy and water, because this is one of the key requirements for all these data centers, because they are very energy intensive. So what I mean with our interactions with the government officials, they are planning for India already have green hydrogen mission. So through green hydrogen mission, converting the green hydrogen as a fuel, which will be used. I mean, in data centers, government is planning to use only the green fuel. It could be green hydrogen, it could be solar, it could be wind. Because the data, the energy requirement is huge. So the government's own missions to be decarbonized by 2070 cannot be met if these energy intensive or heavy energy consumers are left for the fossil fuels. So yes, there are plannings, but in any case, the energy will be from the green source. And yes, water and energy are very focused area for the government, because data centers are very, very energy intensive, right. Water intensive.
So harnessing green energy would be the solution to address the energy requirement, the growing energy requirement.
Yeah, government is planning to, entire energy which will be consumed by the data centers, that has to come from the green source.
Sure. Thanks, Sanjay. So with that, I think we'll end the session for today. If the audience have any more questions, we'll be around till this afternoon. So just get hold of our panelists and you can continue the discussion over lunchtime, right? So I'll just have spread some closing remarks now. So what we've heard today is that the future of CSR lies in the strategic intent, deep partnerships, you mentioned partnerships, integration with core business and accountability in terms of outcomes. It also came out quite distinctively that CSR planning is no longer about selecting projects. It's more about designing systems for sustained impact. Implementation is no longer about execution alone, but it's also about learning, adapting, and scaling responsibly. So this brings us to the end of our panel session. To conclude, I would like to thank our panelists for their great insights they've provided. And let's have a round of applause for all our panelists. Thank you.